Hi, my name is Heidi Miller Brunetto. I'm a psychologist and I work for neighborhood healthcare at our Lakeside Clinic. My initial reservations when we were presented with using telehealth were that I was very anxious. I was a little bit fearful about what this would look like, how I would adjust to providing care over video or telephonic sessions. And as I started to work, especially with telephone sessions, I became a lot more comfortable with the idea of providing it. I think my patients also felt anxious and fearful, maybe were resistant to wanting to use video or telephonic platforms because there is a different type of interaction, a different dynamic that you have when you work with someone in that way. I think we've been able to work through those reservations and get to a place where I feel more comfortable, and as well as the patient. One of the initial steps that I would consider when working with elderly patients through telehealth is to really educate them and support them on the technology. So they may not feel comfortable utilizing the type of platforms that are needed with video visits. So I would maybe consider calling them a couple days in advance or having a resource specialist call them to really walk them through the steps of how to utilize these video platforms, such as helping them to click on the links, to turn on their cameras, to adjust their volume, and to really feel comfortable with where to look and where to place their camera. You may also want to consider utilizing resources for yourself, like a headphone set that may minimize the background noise and help them to be able to hear better. Another thing I might consider is the way that I speak to them. So I tend to be someone who speaks quietly and quickly. I've had to adjust that in ways to really be conscientious of the way that I'm conveying my information. So make sure that I'm paying attention to my tone, my pitch, making sure I'm concise, that I'm explaining it well, I'm slowing down, I'm speaking loudly, and to make sure that I'm very clear in the way that I'm giving them information. I think one of the strengths of using telehealth with elderly patients is the convenience factor. For them, it's not always easy to get somewhere. Maybe they don't have transportation or they don't have someone who can help them get somewhere. And so it's really provided great access to be able to provide this service without any limitations. Another benefit of using telehealth with senior patients is that they may have caregivers or family members who live with them in the home, and it provides a really great opportunity to be able to get additional information if they're willing and consent to that from people who you may not otherwise be able to speak to because they have busy lives and they're not able to come to their face-to-face visits with them. It's important not to assume that the elderly population would be disinterested or not want to use telehealth. I think that's a myth, and that in reality, they're maybe just afraid or uncomfortable or resistant to change, and that they need a little more push or a little more education or a little more help from the provider to be able to feel comfortable using this type of therapy. I started to realize that this was working for the patient when they told me that they felt comfortable with this type of service, that they felt like I heard them, that I understood their concerns, and that they felt like this was benefiting them in the same way, or maybe even more than face-to-face, because they could be in the comfort of their own home without distraction, without having to leave or to set up a way to get to my office.